Welcome to the deep dive. Today, we're looking into something pretty specific, a medical thing that happens with our dogs and cats. It's called idioventricular rhythm.
Yeah, it sounds complicated, but basically we're exploring what happens when the heart's usual rhythm gets disrupted and, well, a sort of backup plan kicks in.
Exactly, and we're using a really solid source, canine and feline idioventricular rhythm, to help us break it all down.
Right. The idea is to make sense of it all, give you the key info without you needing the medical dictionary nearby.
Our mission, then, is to get a clear understanding of this heart event, why it occurs, what it might mean for pets, but keeping it straightforward.
Let's do it.
So first things first, what is idioventricular rhythm in simple terms?
Okay, so think of the heart's main pacemaker, the sinus node. It sets the beat. Idioventricular rhythm happens when that pacemaker slows right down, or maybe the signals it sends down to the lower heart chambers, the ventricles get blocked somehow.
Ah.
When that happens, the ventricles themselves kind of go, okay, guess it's up to us, and they start their own beat. These individual beats are called ventricular escape complexes,
Right.
and if that becomes the main rhythm, that's idioventricular rhythm.
Got it. So it's like the heart's emergency power kicking on. What does that look like if you're, say, looking at an ECG?
Yeah, that's a good analogy. On an ECG, the heart tracing, you see a run of these ventricular escape beats. And the heart rate is usually, well, pretty slow. For dogs, it's typically below 65 beats per minute, and for cats, under 100.
Okay.
There's also a slightly faster version called accelerated idioventricular rhythm. That's 65 to 100 in dogs and 100 to 160 in cats.
Faster, but still originating from the ventricles.
So from the ventricles, exactly. But maybe the most obvious thing on the ECG is that the P waves, those show the electrical activity in the top chambers, the atria. They often look completely disconnected from the QRS complexes.
And the QRS complexes are the ventricle beats.
Right. And instead of being sharp and narrow like usual, they become wide and, well, the source calls them bizarre. They look different because the signal isn't following the normal fast pathway.
Bizarre and wide definitely sounds unusual. Why does this matter for the pet's overall health? Is it dangerous?
It can be. If the rate gets really slow, it can affect how well the heart pumps blood, what we call being hemodynamically significant. But the main point really is that this rhythm doesn't just happen in healthy animals.
Ah, right.
It's almost always a sign that something else is wrong. It's a secondary issue. And interestingly, cats' backup pacemakers tend to fire a bit faster naturally than dogs, which is why we see those different heart rate thresholds.
That makes sense. You mentioned that source has some figures, figures 1 and 2. What do they help illustrate?
Yeah, they're helpful visuals. Figure 1 basically shows you those occasional ventricular escape beats popping up within an otherwise normal rhythm. You can see the odd beat kind of jumping in.
Yep.
And figure 2, that one shows a more serious situation called complete heart block. That's where the signals from the top chambers just aren't getting through to the bottom chambers at all. So the top and bottom are beating totally independently.
And that can lead to the ventricles taking over.
Exactly. That can definitely result in an idioventricular rhythm as the ventricles set their own pace.
Okay, so we've established it's a sign, a symptom, not the root problem itself. It's a safety mechanism in a way.
Precisely. Like a warning light. The light isn't the breakdown, but it's telling you to check the engine.
So what kind of underlying issues make the main pacemaker, the sinus node, falter like that?
Well, one big category is anything that causes severe sinus bradycardia. That's a very slow sinus rhythm, or even sinus arrest, where it just stops firing for moments.
What would cause that?
A common one is increased vagal tone. The vagus nerve sort of acts like a brake on the heart, so if that nerve is overstimulated, say from high pressure inside the skull, or even high pressure in the eye.
Wow, really?
Yeah, or certain drugs can do it too. Things like digoxin, which is a heart medication itself, some tranquilizers, beta blockers like propranolol, other antiarrhythmics like quinidine, even general anesthetics.
That's quite a list.
It is. And then there are diseases, Addison's disease, severe low blood sugar, kidney failure, hypothermia, being too cold, high potassium levels, even an underactive thyroid, hypothyroidism. Lots of possibilities.
Okay, so that covers issues with the sinus node slowing down. What about the other path you mentioned, the AV block?
Right, the atrioventricular block. That's when the signal leaves the sinus node okay, but it gets slowed down or completely stopped on its way through the AV node, the junction box between the upper and lower chambers.
And what causes those blocks?
It can be varied. Sometimes it's congenital, meaning the animal was born with an issue in the conduction system. Other times it could be related to tumors affecting the heart, scarring or fibrosis in the heart tissue, or even infections like Lyme disease.
Lyme disease, interesting. Does this tend to affect certain types of dogs or cats more than others? The source mentioned signalment?
Yeah, signalment just refers to the typical patient profile.
Yeah.
So it affects both dogs and cats. But we do see some breed predispositions for related issues, like English Springer Spaniels and Siamese cats are known to sometimes get atrial standstill, where the atria just don't contract electrically.
Okay.
And then you have breeds like pugs, miniature schnauzers, Dalmatians. They seem more prone to certain types of conduction system problems, which could potentially set the stage for something like idioventricular rhythm if there's also AV block.
So putting yourself in a pet owner's shoes, what might they actually notice at home? What are the outward signs?
Well, sometimes, honestly, there might be no signs at all,
Mm.
especially if it's intermittent or the rate isn't drastically slow.
Right.
But if there are signs, an owner might report their pet seems, weak, maybe just really low energy, lethargic. They might get tired really easily with exercise.
Exercise intolerance.
Exactly. Or in more severe cases, they could actually faint. It's called syncope. And eventually, it could contribute to signs of heart failure.
And what might a vet pick up on during an exam?
A vet might feel an irregular pulse. Sometimes there's what's called a pulse deficit, where you hear a heartbeat with the stethoscope, but you don't feel a corresponding pulse wave in the artery. That suggests the beat was too weak to push blood effectively.
Oh, okay.
They might also hear the heart sounds varying in intensity.
Hmm.
And with certain types of AV block, you might see subtle things like pulsing in the jugular veins in the neck.
So let's say the vet suspects this is going on. How do they confirm it's idioventricular rhythm and not something else that looks similar?
Good question. That's the differential diagnosis part. A key one to rule out is ventricular tachycardia, or VTach. That also originates in the ventricles, but it's typically much faster.
Faster rates.
Yeah, usually over 100 beats per minute in dogs, often over 150 in cats. Idioventricular rhythm is generally slower than that. Also, with other slow rhythms, there's usually still some kind of consistent relationship, even if slow, between the P waves and the QRS complexes. In idioventricular rhythm, that relationship is typically lost. They're dissociated.
Makes sense. What diagnostic tools are most useful here?
Well, baseline blood work CBC, chemistry panel urinalysis is important. It could point towards those underlying metabolic causes we talked about, like kidney failure or electrolyte issues, or maybe drug toxicity.
Okay.
If AZ block is suspected, especially in certain areas, a Lyme disease test might be done. An echocardiogram, an ultrasound of the heart, is really valuable too.
To look at the heart structure.
Exactly, to check for underlying heart muscle disease, tumors, congenital problems. But the absolute gold standard for diagnosing the rhythm itself is the electrocardiogram, the ECG.
That's where you see those wide QRS complexes and the disconnected P waves.
That's the one. It gives you the definitive electrical picture.
So you've got the diagnosis. What's the approach to treatment? Do you try to stop this rhythm?
This is really crucial. Because it's a backup rhythm, a safety net, you generally don't want to suppress the idioventricular rhythm itself.
Right, because that might leave the heart with no rhythm at all if the primary problem is still there.
Precisely. The focus is almost entirely on identifying and treating the underlying cause. If you fix the primary problem, the disease, the drug toxicity, the electrolyte imbalance, the heart's normal rhythm might just take back over.
But what if the animal is really feeling the effects of the slow heart rate, like the fainting or weakness?
That's when you might need symptomatic treatment to temporarily increase the heart rate. The first go-to drugs are often atropine or glycopyrrolate. They work by blocking that vagal nerve influence, trying to let the heart speed up a bit. If those don't work sufficiently, then other options might be considered, like drugs that more directly stimulate the heart, isoproterenol, dopamine, dobutamine. And in really persistent, severe cases that aren't responding, implanting an artificial pacemaker might be the only option.
That sounds quite involved.
It is definitely a specialist procedure.
Are there specific medications that are a definite no-no in this situation?
Yes, absolutely. You want to avoid anything that could further slow the heart rate or make the heart muscle contract less forcefully. So drugs like lidocaine, procainamide, quinidine, those are sometimes used for fast ventricular rhythms, but not here. Also, beta blockers like propranolol and calcium channel blockers like diltiazem, they could make things worse.
Good to know. And you mentioned something about atropine having a potential brief side effect.
Right, just a small point very occasionally right after giving atropine. You can see a very brief, temporary slowing of the heart rate before it speeds up, something vets are aware of.
Okay. So looking at the bigger picture, what's the likely outcome? What's the prognosis for a pet with this?
It really, really depends on the underlying cause and if it can be fixed. If you can successfully treat, say, the Addison's disease or stop the offending drug, the rhythm might resolve completely, and the prognosis could be good.
But if not,
If the underlying issue is serious heart disease or a metabolic problem that's hard to manage, then the prognosis is naturally more guarded. And it's generally considered poor if the heart rate just won't increase despite treatment, or if we just can't figure out why it's happening.
are there potential long-term complications if the heart rate stays too low for too long?
Yes, a persistently slow heart rate puts extra strain on the system. It can potentially lead to secondary congestive heart failure down the line or cause reduced blood flow to vital organs like the kidneys, possibly leading to kidney damage over time.
So wrapping things up, the key takeaway seems to be idioventricular rhythm isn't the disease, it's a sign. It's the heart's backup generator kicking in because the main power is out or flickering.
That's the perfect summary. It's
Yeah.
a sign that something else needs urgent attention. Finding and treating that root cause is absolutely paramount.
Recognizing those potential signs, the lethargy, the fainting, and getting a proper veterinary workup is crucial then.
Absolutely. Early diagnosis and management of the underlying condition offer the best chance for a good outcome.
It really is fascinating, isn't it? How the body builds in these kinds of redundancies, these safety mechanisms. It makes you pause and think, what other systems in the body might have these hidden backups, these unseen plans that quietly activate when things start to go wrong. Just makes you appreciate the resilience built into living things.
It certainly does. A lot happening under the surface.
Thanks for walking us through that today. Really insightful.